Ever wondered why you get butterflies in your stomach when you're nervous, or why your gut is often referred to as your second brain? Well, there's a fascinating world inside us where our brain and gut are in constant communication, and this intriguing dialogue holds the key to our overall health. This communication is facilitated by an extensive network of nerves and hormones. The superstar among these is the vagus nerve, the longest of the 12 cranial nerves. It acts like a superhighway, transmitting information between our brain and our gut. When we're stressed or anxious, this nerve sends signals that can make our stomach churn or our appetite disappear. But the vagus nerve isn't acting alone. It's part of a larger system called the enteric nervous system, often dubbed our body's second brain. This system governs the function of our entire gastrointestinal tract, influencing everything from the digestion of food to the rhythm of our gut motility. Our mental state plays a pivotal role here. Emotions like anxiety, sadness, or excitement can trigger symptoms in the gut. That's why, when we're nervous, we might experience that familiar fluttery sensation. On the flip side, trouble in our gut can send signals to our brain that trigger mood changes. The connection is so intimate that even the mere thought of eating can kickstart our digestive process. Miscommunication between the brain and the gut can lead to physical symptoms like bloating, pain, and changes in bowel movements. This is where conditions like irritable bowel syndrome and small intestinal bacterial overgrowth come into play, but we'll get to that shortly. Now that we've uncovered the mystery of the gut-brain connection, let's delve a little deeper into how this connection can go awry, leading to conditions like IBS. This is a journey into the intricate world of our bodies, where every flutter and rumble has a story to tell. In this complex dance of signals and responses, our brain and gut are in constant conversation. But what happens when this dialogue gets muddled? It's akin to having a crossed wire where the messages sent aren't the ones received. This miscommunication can lead to some unpleasant outcomes, including symptoms associated with irritable bowel syndrome and small intestinal bacterial overgrowth. Now let's delve a bit deeper into this. The brain sends signals to your gut through a network of nerves, the most significant of which is the vagus nerve. These signals help regulate gut motility, which is the movement of food through your digestive tract. When this communication goes awry, your gut motility can become irregular, causing symptoms like bloating, constipation, or diarrhea. But what could possibly cause this miscommunication? Stress and anxiety are key players. Picture this. You're about to give a big presentation. Your heart races, your palms sweat, but your gut also gets the memo. The brain, in response to the perceived stress, sends signals down to the gut, which can result in a flurry of activity, a bit like a gut panic attack. This can exacerbate IBS, leading to discomfort and distress. However, it's not just about the physical symptoms. The gut-brain miscommunication can also impact your mood. Ever felt butterflies in your stomach when you're nervous, or a knot in your gut when you're upset? That's your gut-brain connection at work. This intricate relationship between the gut and brain is why some people may feel down or anxious when their gut isn't in top shape. Understanding the root cause of these symptoms is the first step towards managing them effectively. By acknowledging the role of the brain-gut connection, we can explore ways to keep this line of communication clear, possibly improving both our digestive health and overall well-being. So, if the brain and gut are in constant conversation, how can we make sure they're speaking the same language? Well, a poor connection between the two can lead to a host of issues like irritable bowel syndrome, small intestinal bacterial overgrowth, and impaired digestion. These issues can drastically affect your overall health, causing discomfort, stress, and even insomnia. But don't worry, there are ways to improve this gut-brain dialogue. Start with a balanced diet, rich in fiber and probiotics. Regular exercise also helps to improve gut motility and reduce stress, a major disruptor of the gut-brain axis. Speaking of stress, relaxation techniques such as meditation or yoga can also encourage a healthy connection. However, if you're experiencing severe symptoms, don't hesitate to seek professional help. Doctors and dietitians can provide personalized advice based on your specific needs. Remember, a healthy dialogue between your brain and gut is key to your overall well-being.